Now we are going to the last invited speaker. May I invite Dr. Mehdi Ebrahimi, researcher from Prince Philip Dental Hospital, the University of Hong Kong. And the topic is Halal biomaterials in therapeutic and regenerative medicine, impact and importance. On the stage.
السلام عليكم ورحمة الله وبركاته. الحمد لله رب العالمين والصلاة والسلام على سيدنا محمد وعلى آله وصحبه أجمعين. اللهم علمنا ما ينفعنا وانفعنا بما علمتنا وزدنا علما. So again, assalamu alaikum wa rahmatullah, and thank you for you to be still patient to be here at the last moment, and especially after the lunch and you are waiting to go outside. I know many people feel sleepy, but please, especially Dr. Mukhtar, pay attention to me because he's the one who invited me. So actually my topics is I think it has been covered very well by most of the speakers today, but what I was very happy to hear today that halal is not only food. Halal also could be dressing, could be belt, could be your praying mat. We're going outside as a Muslim, we have a prayer mat and we put it. So if you know that there are some traces of pork or from porcine origin in your prayer mat, are you happy to pray? So this is the importance of halal. So halal is not only food, it comes to different areas. So especially for my field, because I work on I'm a dentist originally and I'm a surgeon also at the same time. So in medical field I'm using lots of products, because many of the patients, you can go to the dentist anytime and he's applying in your mouth lots of things. He's doing root canal treatment for you, he's doing tooth filling for you, he's irrigating the tooth with some things, he's doing scaling for you. So if you know that any of this product is from pork, are you happy to do that? Or are you going to allow the dentist to use that in your mouth? No. So, but unfortunately, in medical field, there is no criteria. There are thousands of biomaterials in the market and are used by many dentists, many surgeons, many physicians, and they are not halal. But because it is, as long as they hear that it is not from pork, also they think that it is halal. For example, what I call it is like tissue defect. So tissue defect, it could be bone, dental tissue, cartilage and skin in the medicine and in dentistry, and it can be any part of the body. The patient may go to the dentist or the hospital with many defects. It could be in the tooth, in the bone, so the surgeon or the dentist, they are going to use different products. So in medical or dental field, they categorize the products in 4 main categories. It means like if the patient have a defect in somewhere in the body, so we take some tissue from the same body, from the same patient, and we put it here. For example, there is a skin defect on the face, so sometimes we take skins from the leg, this part, and we transplant it. So that part, that is called autograft. So autograft, there is no issue, because we are using from the same individual, transplanting to the same individual, same to same. So it is autograft, and it is a gold standard. But the gold standard is not always available, because sometimes the patient comes to you with bone defect and there is no other bone in the body enough to take it and put it here, for example. So there is another option, we call it allograft. Allograft means these are the bones that are taken from the dead human body. I'm not here going to say it is halal or haram, because this is the problem with the people who are studying the religion. So they have to clarify whether if any bones or any tissue is taken from the human cadaver, is it halal or not. So these are things, but this is the option that I'm trying to tell you. The third option is xenograft. Xenograft, there are some materials that are taken from the animals, and pigs is only one of them. So we go back to cow and horse. As a Muslims, we see, yeah, we can eat cows, meat. We can eat beef. But if it is slaughtered in Islamic way, so what about if it is not slaughtered in Islamic way? Does this product is halal to be applied in medicine or dentistry? I'm not sure. You have to ask again the fatwa or Muslim, or the people who are expert in this field. And the last one is alloplastic material, which is my expertise. We work on production of some synthetic material, which is not taken from the animals or human in the lab. So biomaterials, as I mentioned, it is any materials that you engineer it, produce it, and then you can use it in the human. And the purpose is therapeutic, regenerative, or it also good, sometimes used for diagnostics purposes. You see, like in medicine and dentistry, if you go to the market, you see thousands of products that are used. For example, in cosmetic surgery, in ophthalmology, eye drops, in surgery, in osmotics, and even the pills and medicine that we are using it. Capsules that we are using it, which is antimicrobial capsules. Sometimes they have a coatings which is taken from the gelatin of the pork. So the material which is inside the capsule is halal, but the coating is not halal. And also there are also lots of things that I just put for you some examples, that there are maybe more than thousands of products in the medical field, but there is no issue about that. No one talk about that, because most of these products are produced from the different, like, well-developed countries. In Switzerland, in Germany, in like Netherlands, in Finland, they are producing these materials and they are sending to lots of the countries. But as a responsibility of Muslims, we are responsible to urge them and to force them and to educate them that there are also issues of halal even here. Okay, so the biomaterials itself, as I mentioned, the biomaterials that they are used in the medicine and dentistry, it could be of two natures. It could be either from natures or it could be synthetic, as I mentioned. So if you see the tables, there are some products that are naturals, but the collagen, for example, it can be from different animals, including the pigs. The gelatin also, it could be from pigs. And at the end you see even the fibrin and bone, it could be from pigs or from other animals also. So this is a natural one. So as long as it is natural does not mean it is halal. But many patients don't know. They think like it is natural, it means taken from plants. No, natural could be from any animals also, not only plants. This part is the one that I like it, because this is the materials that usually synthetic in the lab. So the halal issue is not very important here, because most of them are chemicals and it's not taken from the pigs or other animals. So here we can produce and you can use lots of materials which are within the halal criteria, so they can use it. So this is, they call it biomaterials which are synthetic. So you see, like, if you just have a snapshot to the markets, you see all of this product, especially in the top, that we are in the clinics working with lots of bone graft. And this bone graft, actually, when the patient come to me, what I can tell him, like, this bone graft biomaterials is not taken from pork, it's not taken from pig, so it is from bovine, it is from cow. But I'm sure that this bovine has not been slaughtered in Islamic way. According to the Professor Mus'ab, when he mentioned that even the animal, when they use some product from animal, even the cow, so is it slaughtered in Islamic way? I don't know. The animal has been slaughtered in Switzerland or Netherlands or Finland. I was not there at that time. But I know it is from bovine. So if you give the patient two options, this from bovine, maybe slaughtered in a non-Islamic way, and it is shubha, and there is another one from pork or from pigs, and we want to augment your bone here to put implant, I don't think that he will accept. He will never accept. So he will select the bovine bone, which is taken from cow or from fish or from something. So all of this product, as you see, it could be from any origin. So halal biomaterials is important for me, because I think that Islam is the fastest growing religion in the world. You can't find Muslims in any corner in the world. And also, it is the second most prominent religion in the world. And we know that there are some regulations about the Muslims that they are strictly prohibited, because if you tell me, for example, what is the difference between animal that is slaughtered in non-Islamic way and between that animal and a pork. Pork is haram mughallad. It means like even the hair, you cannot use it. So the level of haram is too high. Then you can go to the next step, which is like animals which are not Islam. For example, chicken or fish, for example. So in the fish there is nothing about non-halal. So we can categorize it. And as I mentioned, unfortunately there are in the market hundreds of materials which are non-halal, and the dentists and practitioners, they are using it. Sometimes maybe it is simple dressing. You go to the hospital and they use some dressing to close your wound. Or sometimes they use suture. If you have trauma, have some injury, they use suture to close, and that suture is from pork. Okay, so for me, I just categorize the non-halal product in two main parts. One is the materials which are taken from the pork directly. And the second are the materials which are there in the market. For example, the bone is a bovine bone, is a bone taken from the cow. But as Professor Musab mentioned, additives has been added to it as a preservatives to hold the property and to increase the shelf life. And additives is from pork. So the bone, sometimes maybe if you go to the dentist, he say like, I use a bone graft which is from cow. But if you see the ingredient at the end, even the dentist is not aware. There is E something, and that E code is haram, taken from pork. So finally, this is contamination, and as a Muslim, this is not halal, because you add some things which is not halal. So this is also very important. We have to be careful about that. And the last issue, which is maybe not very clear, about the issue of use of human cadaver parts. For example, bone from human cadaver. Can we use it in medicine and dentistry? So many patients ask me, can we use that one? Are you going to apply? I see that if there is no other alternatives, then you can use it. What I do, I need some things and it is not halal. Halal option is not available in the market, so let the patient die? No. So if there is no other alternatives, I think we can use it, for the time being at least. But if there are alternatives, materials that have been produced in the lab, or materials that are taken from the fish or shellfish or some animals in the sea, then we can use it. But unfortunately, the percentage of that material is maybe less than 5 or 10%. 90% of the materials are non-halal, which is used in medicine and dentistry. More than 85 or 90%, I'm sure. So, and I mentioned also, the problem is not only the patient, the problem also is with the educated people. Like I have lots of students in different parts, I have been in different parts of the world. So the students that are graduated and are working in the private clinic, they don't have knowledge how to select a product from the market. And the materials that they are using is not halal in their practice, and they are Muslims. So we have to blame them, because this is the responsibility of the practitioners. He should be educated, and also the patient should be educated. So as a practitioner, me and all of you are educated here, you have two responsibilities. First of all, to educate yourself to the new non-halal materials that are there in the market. For example, E. code, which are contaminated all of our foods. So when I came to Thailand here the first time in 2008, I seen the water, halal water bottle, is written halal. So at that time I was very confused. Why they put on the water halal logo? What's the issue of putting halal? So when I was talking to my friends that there are halal water in Thailand, they were telling halal water in Thailand, there is non-halal water. So then I asked the people here in Halal Institute at that time, 2008, they told me no, the halal water is halal, but the problem container, which is plastic container, bottle, sometimes the materials are taken from the pork, it's from pig. So the Muslims, they don't want to drink water in a container of pork. So this is the basic ideology behind that, and I think it is right. It is a human right, and it is a patient right. So we have to educate ourselves, and also we are responsible to educate people. For me as a dentist, I have to educate myself to be familiar with the products, and also have to educate the patients which are coming to me. When they go outside, they know, and they have to ask the dentist or physician, you are going to use this product, is it halal or not? So just as a simple examples, I just want to shed your attraction to this slide. This is only examples of bone grafts that we are using in medicine, and also the orthopedic people, they use it. So from different country, Germany, France, USA, Switzerland. So the red mark are those taken from porcine. You see, there are many. This is only one list. So there are many products that are taken from the pork. And even the bovine one, which is there, is taken from the cow. So again, if you ask the company, I'm sure that they will tell you this animal has not been slaughtered in Islamic way. But at least this is one option that I have, rather than selecting the materials from pork. And you see, so for example, at the end, maybe it's not very clear, is a company from Germany. One company, they are producing around 4 products from pork, from cow, and synthetics, and from human. So one company is producing 4 different products taken from different sources. So we have to be careful about that. And this is our duty to educate also the academic people and also the student in the university. So at the end, because this only was part of the study that we are doing it, I think that we need educations. First of all, to educate ourselves, and second, to educate the students who are there with us in the universities, both medical and dental practitioners. And the second one, also the patient should be consented, because if you fail to inform the patient that the product that you are using it is mashbuh, or it may be not halal, then you are ignoring the human rights and the patient consent. Because patient, when he comes to you, he trusts you. But nowadays the trust is not only word. You have to prove it. You have to prove it, and the proof is by the evidence and references that we are coming here these times to collaborate together. So universities, industries, business sectors, private sectors, governmental sectors, they come and join together to help and to share, and also there is a good opportunity for business at the same time. So that's why this is my final parts and final boards here. I don't think I have another slide at the end, so this is the last slide. I just thank you, and also Brother Mukhtar and all of the organizing committee, to see you here. And then I just want to add that Allah subhanahu wa ta'ala make us as a Muslim in a different way. So we are Muslims and we are blessed to be Muslims, and one of our good criteria that we had it from long back generation, from Prophet Muhammad sallallahu alaihi wasallam till this time, is that we work as a teamwork. We are not single. We are not only one person, because we are as a human, one part of the body. So if there is any pain in my tooth, I cannot sleep. If any pain in my hand, I cannot sleep. So we are from different parts of the world, but at the same time we are one body. So we have to collaborate, and we have to work, and we have to network, so we can serve our community, and then inshallah the world. وجزاكم الله خيرا والسلام عليكم ورحمة الله وبركاته.
Thank you, Dr. Mehdi Ibrahim.